Hi everyone, and a very warm welcome to you all. I'm Claire Redhead, I'm Executive Director of OASPA, and I'm delighted to open the 2021 OASPA conference today. There are almost 700 people registered for the conference from over 70 countries around the world this year, so you're going to be in great company over the next 3 days. We're really happy to have you all here. Zoom works really well most of the time, but I know the downside in this webinar format is that you can't actually view who else is here. So please do say hello in the chat. I've seen some of you are already doing that. Let us know who and where you are. And Bernie's also sent details of our Slack group where you can meet other delegates, and an attendee list was sent out as well with details of people who gave consent to share their names and contact information. We're also building up a visual representation with a map in Mentimeter. This is what it was looking like not so long ago. So some of you have already started putting your location on there, and you can see where everyone in the world is who's joining the conference. To add your own location, if you haven't done so yet, you can access at menti.com using the code here on this slide, or you can scan that QR code with your phone. And we'll show this again throughout the conference, the details of how to access and also an update and what it's looking like. So if you want to come back to it in one of the breaks, you can do that, but please do add yourself only once. So last year we took the conference online because we had to, but there were so many positives for us. And the best of all being that we can welcome so many of you to join this event and engage in these discussions. Zoom meetings are fairly normal for all of us now, and although we do miss meeting people face to face, I'm sure that meeting online is also going to play an important role in the years to come. And there's enormous creativity and resilience in this community to keep making progress with open access and to collaborate in a meaningful way. So in this conference, we're building on last year's experiences with purpose this time. And to me, it feels a little as though the rule books have been thrown out, and that we always did it this way, or it would be hard to change. Mindset has been well and truly challenged in our lives recently, not just in how we come together to connect, but in many other aspects as well. And as far as open publishing goes, we have this moment in time to really question what are the crucial elements of the research process, to examine what are we doing in scholarly communication to support them, and to think about what part we can play in making things better and fairer across the globe. In this conference, you're going to hear perspectives from so many inspiring people. And most of our programme is specifically curated by our programme committee, and they've done an absolutely phenomenal job. As well as our keynotes and discussion panels that have been organised, we also put out a call for proposals for our lightning talks and poster sessions. We received so many fantastic responses about exciting things happening in open access and open science, more than ever. So we've added a third lightning talk session this year, and it's going to be great to hear from all of those presenters as well. You can see those posters in Slack. You can contact all of the speakers there. And if you missed the invitation to join the Slack group, then please just let us know. There's just one link per day to join the conference, as Chloe said, so this broadcast will run through the next few hours, and there'll be some breaks too, of course, so you can get away from the screen. To work across multiple time zones for our speakers, there'll most likely be some sessions that aren't scheduled during your normal working day, but we hope you'll be able to join us for as much as possible to fully immerse yourself in the discussions and switch off from your work emails for a while. Thank you to those of you who are getting up early to join us or who are able to stay late into the evening. And for any sessions you do have to miss, we'll be sharing the recordings as soon as they're ready. So please add your comments throughout the conference, share your views and ask questions throughout the 3 days. All of your input is very welcome, and we're really looking forward to hearing from you. If there's anything you're not sure about or you have any problems at all, then we're on hand to help you. So before we get started with the conference properly, I'm going to take a little time just to tell you about OASPA for those of you who don't know us very well, and an update on things we've been doing this year, which actually, when I had a look, was quite a lot. So established back in 2008, OASPA has matured and evolved as much as open access has itself since then. As an organisation, we found a place within stakeholder discussions as a trusted entity, working to encourage and enable open access and bringing the perspectives of a diverse range of publishing-focused organisations together with a growing number of essential infrastructures. OASPA has expanded its membership steadily over the years and now has over 170 members. We've been in a really exciting growth phase this year, which has enhanced our community even further. At the end of last year, we changed our trading name from Open Access Scholarly Publishers Association to Open Access Scholarly Publishing Association, which better reflects the diversity of members we have today. 75% of our publisher members are fully open access, but we have many mixed model publishers too who are members of OASPA. The largest category of our members are actually running publications on a volunteer basis, and we help those smaller publishing operations with support and guidance on a wide range of issues. We have key supporting services and open access infrastructures as members too. And if you're interested in finding out more about our members and membership, then there's information on our website, but please do feel free to contact us directly. We also recognise that many in the community would like to support our work and be more involved with an OASPA, but may not be publishing or running infrastructures, so perhaps not eligible for full membership. So we're introducing a new category to enable those organisations to work more closely with us and help us achieve our mission. And we'll have more news on that later in the year. But again, please feel free to contact us if you have questions in the meantime. All of our members have signed up to OASPA's goal of advancing open access. Our mission is to encourage and enable open access as the predominant model of publication for scholarly outputs. And alongside this, we promote best practice and ethical standards in open access publishing. We showcase innovation and the diverse business models and policies that support open access publishing today. Often the work we do is in collaboration with other organisations we align with that have similar goals. And this year, when I've looked back, we've been working on a whole host of things. We were involved in the Diamond OA Journal study and the resulting report and recommendations with a consortium of other organisations. We jointly held a workshop with LIBA's Open Access Working Group at the LIBA conference. We hosted workshops in conjunction with Opera on innovative business models for open access books. We continue to work actively on the committees for Think, Check, Submit, C4 Disc, and the OA Books Author Toolkit led by OAPM. We endorsed Make Data Count this year, and we're collaborating with them on ways to improve data citation in publications. And we're on the Research Identifier National Coordinating Committee in the UK. We support the Open Publishing Awards and the COVID Rapid Review Group, which contains several of our member organisations. And we're collaborating again with DOAJ, COPE, and the World Association of Medical Editors to review and update our joint principles of transparency and best practice in scholarly publishing. And we also contributed to the United Nations Global Conference on Open Science in the summer. Internally, we've been reviewing and updating our membership criteria and our code of conduct for members. We collected and published open access books publication data from our members, and journals data collection is also underway. We run interest groups for our members focused on both open access journals and open access books. Fully open access publisher members are eligible to join those, so please let me know if you're a member and interested in either of those. And we've been doing some work on exploring the open access market with the support of research consulting. And there'll be a session on our reflections from the work we've undertaken held on Thursday, and we'll be releasing a report this week as well. We have an ongoing strategic partnership with the OA Switchboard, which we founded last year. We manage the communications, and I'm chair of the board, and have been working with the executive director, Ivona Kampfens, in this, the first year of it being fully operational. And it's a truly amazing collaborative experience. So I'd recommend that you, if you have time, watch the recording of the most recent webinar that we held, which gives a really good overview of the exciting progress being made by all of those already participating in that. We've continued to run webinars on topics such as open access books, metadata, on Make Data Count. We've taken a look at Australia's open access journey this year, and also researcher needs and values. And we've got 2 more webinars which will be held this autumn. Our webinars are available throughout the year with no fee to join, and all recordings are available freely on our website. And then there's this conference, of course, with more attendees and more presenters than ever. We've also been formalising OASPA as an organisation. Behind the scenes, we're a very small team of 2.5 staff, and we've been making sure that the organisation is sustainable and on a good footing to grow in the future. We run the organisation on the limited funding that we get from membership and conference fees and the support of sponsoring organisations which cover our running costs. But we have big ambitions, and I'm proud that we achieve such a lot each year by taking a smart approach to our activities and making the most of what's a very lean organisation. Beyond all this, we convene a broader group of people interested in open access and open scholarship, and we see fantastic engagement from participants. So thank you to everyone joining here and our other events, and we look forward to hearing from you at this and at our webinars. So this leads me to some other thank yous. Every year we couldn't run this event, and couldn't run OASPA in fact, without the generous support of sponsoring organisations. So thank you so much to all of our 2021 sponsors, and big thanks especially to Chloe and Copyright Clearance Centre for hosting the conference for us this week. Thank you so much to our amazing programme committee this year. Thanks for taking time to give your input and share your perspectives to shape the sessions which we have, which are looking absolutely fantastic. We have a really tremendous 3 days ahead of us, and we're indebted to you all for that. So thank you. Thank you to all of our presenters for giving your time to talk to us about your work and participate in discussions. We have so much to learn from you all. And very, very importantly, I have to give huge thanks to Bernie. She's done an incredible job of managing the whole process and bringing everything together in the culmination of months of preparation. This is the 10th conference that I've been involved in. I can tell you it's an enormous amount of work to put together a programme like this, and Bernie makes it all look so seamless. So thank you, Bernie, for all of your hard work, which is very much appreciated. And I'm hoping our attendees will get to hear from you in person at some point over the next 3 days. And then last, but by no means least, thank you to all of you who are joining us in the audience. We're absolutely delighted to have you all here. We do have a participant agreement, which I want to draw your attention to again. Hopefully you've seen it already. We want you to all feel comfortable, so please do read what our expectations are. It's on our website, and it'll be up on the slides in the breaks, but perhaps Bernie can put the link in the chat as well. We'll send you a short survey after the conference, and we'd be really grateful if you could spare a little time to give us some feedback. We do read all of it, and we do always use it when we're planning for the following year, so it'd be great to get your thoughts. So all that remains is to wish you all a great conference, and again, please do contact us if you need anything. And I will stop sharing my screen. I'm going to stand in for Leslie Chan now, who's sadly not able to join us on screen right now, but has been a fabulous member of our programme committee this year. We've benefited so much from his perspectives and insights. So Leslie, thank you so much for all of your hard work in organising the sessions today. First, we have our keynote speaker, who I'll introduce in a moment. Audience members, please feel free to share your thoughts in the chat and put any questions in the Q&A box. We'll take those afterwards. So I'm really delighted to be able to introduce our keynote speaker on Leslie's behalf. Dr. James Tumwine is Professor of Paediatrics and Child Health, who recently retired from the School of Medicine, College of Health Sciences in Makerere University at Malego Hospital in Kampala, Uganda. But he's now teaching at the Department of Paediatrics and Child Health at Kabale University in Uganda. Professor Tumwine is the founder and editor-in-chief of African Health Sciences. Started in 2001, the journal is an open access, free internationally refereed, multidisciplinary journal, publishing original articles on research, clinical practice, public health, policy, planning, implementation, and evaluation in health and related sciences in African countries. Professor Tumwine will be sharing his journey as a doctor in rural Uganda, while speaking about the existing biases in the international publishing system and its implication for health equity for global South countries and for everyone around the world. Dr. Tumwine's experiences may be a real eye-opener for many of you, and his message will prompt you to rethink your knowledge production and publishing practices that you've taken for granted. Thank you, Dr. Tumwine, for accepting our invitation to address this global audience, most of whom are involved in publishing practices in one form or another. It's an honor to have you speak to us today on the subject of knowledge production and health equity. Thank you so much for taking time to join us. Please, the floor is yours.
Thank you very much, Claire. What a pleasure being chaired by you. I've just met you, but it's such a pleasure. We are going to miss Leslie, but he will be able to listen in. So I'm James Tumwine, and right now I'm calling from very near the Uganda-Rwanda border, also very near the Uganda-Congo border. Our area is famous for mountain gorillas. So when the COVID-19 epidemic goes off, you'll be very welcome. We shall give you very nice welcome. I'm going to talk about knowledge production and health equity. And it's basically through my small personal lens. I was born in a very poor family, in a poor village in Uganda, but I have been transformed into a professor. What a journey. And I'm therefore going to share my experience in knowledge production and also how I dealt with health inequities. So the first thing we are going to do, we are going to take a trip through the equity lens, and then I'll discuss some challenges in health systems, largely in low-income countries. I'll talk a little bit about poverty, and I'll share experiences with knowledge production, with particular emphasis on equity. And I'll end up calling for a radical rethink of what we do. So now I hope all of you have had your COVID-19 tests. If you haven't, please go and have it. And also, if you're able to have the vaccine, take it, because you won't enter Uganda without either the vaccine or a negative test. Okay, so now we have arrived at Entebbe International Airport and we've driven to Kampala. And what will strike you in the area of health is Uganda's disease palace, the so-called National Teaching Referral Hospital. I call it the disease palace because we are forced to go there when we are sick. And everybody is welcome. And on the left-hand side is the Ivory Tower, which is the university from which I've just recently retired. But I was honored, I was given a lifetime appointment as Emeritus professor for, I don't know why they did it, but possibly by the end of this talk, you'll appreciate. So special welcome to the Ivory Tower and also to the disease palace. The disease palace is just across the valley. The Ivory Tower is on another valley. And in between, there is one of the worst slums in the world. What a paradox. The Ivory Tower and the disease palace, and in between, loads and loads of poverty. I was trying to see how I can tackle the subject of equity. And at the end, I decided not to tackle it. But I came across this very interesting diagram. Beginning the left, we see the reality of life. So some people have too much. They have so many opportunities. They can see very far. Some people have only a glimpse of opportunities. And others, like those who live in slums, both in low income, but also in high income areas like Tower Hamlet, like Liverpool, like the slums of Georgia, Atlanta, where I visited. And when I went back to Uganda, I had to cry for a whole week because I'd never seen such deprivation and poverty and ill health and alcohol and drugs in the greatest nation on earth. It really hit me. But you won't see that type of thing when you watch CNN or BBC. No, you won't see the poverty in Liverpool, the poverty in London, in Tower Hamlet, as I've said. You will not see that poverty because it is hidden away. And the radios and televisions are ashamed of showing the world how much inequity there is in the very rich countries. But even those who live in the very poor countries, we are ashamed of the inequities. We want to show you the ivory towers, the parliament, the shopping malls, but not the poor slums where people starve. So I decided to use this equity diagram, which is not mine. You can get it online. So you have the reality. You can attempt to be equal, and that won't help the poorest of the poor. You can use an equity lens and equity ideas, and there everybody will have a view of that beautiful ground. But one would say, why do you need that war? Why don't we work together to remove the inequity war? And for me, that's the challenge I'm proposing, that we need to remove this war that separates us and puts us into silos of high income, low and middle income. And where we who live in the low income areas have to live and eat the crumbs under the table of Mr. Biden. We thank him for the 1.4 million doses of COVID-19. Very grateful, because we need 44 million doses. So when we get 1.4 million, it's better than nothing, but it's not equitable. As I try and push down my slide, I would like to discuss the challenges in the health systems of the world. At the global level, we have the apartheid practiced by Canada, where they are hoarding millions of doses of COVID-19. And as the doses of COVID-19 are expiring, they don't know what to do with them. And now they're sending them to us expired or about to expire. And they're also thinking of giving a third dose without any scientific basis whatsoever. The pig farmer and their overpriced supplies, the poor can't afford them. The megatons of carbon dioxide that are damaging the ozone layer and directly or indirectly causing the fires in California and the floods in London and in Uganda. But for us, what is important is that disproportionate knowledge creation, the high-income countries versus the low and medium-income countries. It is shameful. And I'll try and talk more about it later on. At the local level, we have health systems that are in intensive care. And recently in Uganda, this has become stark with the sickening cost of private health care exposed by COVID-19. Very poor countrymen and women here were faced with bills of 5 million Uganda shillings. Put it in perspective, that is 1,500 US dollars in a country with an average income of about $500 per annum. These unscrupulous businessmen and women who make money trading in health, detained dead bodies, etc. When health goes to the marketplace, then health equity dies with it. That reminds me of the shortage of or SOS syndrome. Like you have shortages in London, so we have shortages in Kampala, shortages of blood when you need blood transfusion, shortages of oxygen. This morning, I was hearing of shortages of gas to heat the homes when the winter comes. When the prices of gas go up in Tower Hamlet, or rather in Liverpool, for example, in the poor areas, it's not the rich who suffer the high prices of gas. It's the poor, those who are never seen or talked about. I have mentioned COVID-19 patients in private hospitals are asked to pay millions in deposits before getting treatment. If this is not inhuman, what is it? So to understand knowledge production and health equity, we have to think about poverty, whose condition is not our choice, but at times we are born into it or we are thrown into it by public or private decisions at times. Sometimes decisions that are international and sometimes decisions that are local. Previously, when the world was working on Millennium Development Goals, before the Sustainable Development Goals, the MDG 1A was to reduce or to have extreme poverty by half. And that means people living on $1.25 per day. And this picture shows the performance of Uganda. So we really did well. But between 20 and 30% of the population are still living on $1.25 a day. So one of the challenges is shortage of money. And when you talk to people in the West, USA, Canada, France, when President Obama was there, they were talking of the credit crunch. And I used to laugh because for us, since I was born, I have been in a credit crunch. So we have what I call the chronic credit crunch. For you who live in the West, this is an acute problem because it's acute credit crunch, acute shortage of money. But for us, it's a chronic condition. And the treatment and the prevention of chronic illness might need different approaches to the prevention and management of acute illness. So for us, we suffer from chronic credit crunch. For you, some of your people might be suffering from acute credit crunch, precipitated this time by COVID-19. We have a very young population. And one thing that they are looking for all the time is knowledge. But what type of knowledge are we giving them? And where is it coming from? Well, I happen to be a teacher of doctors and nurses and pharmacists at undergraduate and doctoral level. And one thing that disturbs me is people have lost part of their literacy. Remember, part of literacy, we do arithmetic. So you are asked, what is 13 times 5, which is 85. But most of our students, like your students, those from New York, I've met them, those from Bergen in Norway, you ask them what is 13 times 5, they pick out their mobile phones or their calculator to work out that simple sum. And when you do that, we have scientific evidence to show that the part which does the calculation in your brain slowly dies. And that part of the brain is the one which has cognitive function, which talks about conceptualization when you are doing research. So you find that knowledge and knowledge creation becomes a challenge for our very young people. Talking of young people, in Uganda, one pediatrician has about 200,000 children to treat. But in Kampala, one pediatrician has like 5,000 children to treat. Very much like what they have in Norway. So the rural-urban inequities are quite glaring. In the new place that I work, there are hardly any pediatricians. There are 3 of us in active practice, with a population almost that of Kampala, which has 95% of the pediatricians in the country. We also have a very young population. And invariably, that is a dependent population because of their nature. They are still in school, but also of unemployment. So I want to tell you a story. I was born into a family, a poor family in the hills of Kigezi, which you can see there, the so-called Switzerland of Africa. I think it was coined by Churchill of UK. He was so impressed with the beauty. And I really want to invite you after COVID for you to come see our beautiful place. My dad's first wife and her child died of pregnancy complications. I grew up in this poor environment, but survived and blossomed because of my entrepreneurial parents who had never seen the inside of a classroom, but were full of indigenous knowledge. Let me give you an example of my late dad's indigenous knowledge. Every end of August, he would come and tell us, this year we are in trouble. There will be no rain. We said, there will be no rain? Why? Why do you say that? He said, I have observed all my life that if we don't get rain by the 26th of August, we shall get a famine. And this was through meticulous observation, recorded in his brain, not in his notebook or laptop, because there were no laptops then. In the 1980s, I worked in Zimbabwe, helping set up district health systems whose slogan was community participation, with community health workers at the core of this transformed post-colonial health system. I lived in a village, a little village, Chimani, where access to published papers was very, very challenging. There was no internet as we know it now. And I had traveled to Harare, the capital city, about 413 kilometers away to access University of Zimbabwe Library. Today, obstacles still remain, even with open access. Some journals still demand a credit card. But for us, the card is rare in Uganda and many other low and middle-income countries. The well-to-do, of course, have the credit card. But we don't have many well-to-dos. And you try in Kampala or in Kabale, where I am talking from, to access a non-open access journal. It is a pain. It is a real pain. And that's why we have joined the open access revolution. I have been trying to understand knowledge production and what it means. It is simple. It means the way knowledge is produced. But we must take a deeper route. And now we know there are three models of knowledge production. That which is motivated for its own sake, not concerned with applicability of the findings. And the scientists call it the so-called basic research. The second mode is the new production of knowledge, which is action research. It's not just collecting knowledge, but it's action research. And the third one is contribution to innovation through systems improvement. For us, knowledge creation means simple conceptualization. And once you conceptualize the idea, once you understand the problem, this influences your study design and ethics. We strongly encourage our students to answer a clear, specific research question, rather than just collecting data for, introducing that word, which is a Ugandan word, into the common language. It means aimlessly, without any idea. You do not create knowledge by going to collect data without a research question. If you do that, you are like a headless chicken. And this emphasizes the importance of a written proposal for the research. And more importantly, we must have ethical approval for the knowledge we are creating, because knowledge comes from human beings, from people, human participants. And if you are not ethical, you might end up doing gross harm. When you think about it, we need a radical rethink, because the health sector, the research sector, the education sector has deep-rooted hostility towards frontline workers, particularly health workers. And yet they are the knowledge producers in the homes and villages of Africa. The shopkeepers, the nursing aides, the traditional birth attendants, the grandmothers and fathers. They are the first and often the only point of contact for many mothers, fathers, children, and elderly, as they await what Robert Chambers called the rural development tourist. But knowledge must be disseminated. And in our case, and in the case of this movement and of this conference, we use journals, such as our own journal, the African Health Sciences. The others use policy briefs, barazas, workshops, places of worship, schools, radios, television, and these days, social media, webinars like this one. But social work is notorious for really not spreading knowledge. They spread the opposite of knowledge. And since English isn't my mother tongue, I don't know what the opposite of knowledge is. Maybe lies. But they call it fake, F-A-K-E. A lot of the material spread on social media is fake. And yet our scientists engage and participate in the spread and dissemination of fake material. And the poorest of the poor often are the most difficult to reach. Because when you read research on the mobile telephone, they tell you, mobile telephone is now very common in Africa. Yes, it is common, but it's not smart. Most of the mobile telephones are not smart. So we have basically to use short messaging, SMS, and we lose out about the benefits of a smartphone. Smartphones are damn expensive in my country. So what have we been doing? Collaborative research and training for us is key. And in this picture, you see some of our collaborators. We have collaboration in Uganda, in Sudan, South Sudan, Norway, France, Sweden, Burkina Faso, South Africa, Canada, Zambia, and other areas. And when you collaborate together, you find solutions for common problems and challenges. And in Europe and USA, we need to sensitize our people how we all live in a small global village. When China, Africa, or Syria, or Afghanistan sneezes, well, you know, of course, we catch a cold. Think of malaria, HIV, Ebola, COVID-19. When we get a terrible wave, what shall we do? So what have I said? I took you on a trip to Uganda. We met challenges in the health system. We discussed a bit poverty. I shared experiences with knowledge production, and I called for a radical rethink. I want to thank very much the organizers, but also the African Journals Partnership Project, funded by the National Library of Medicine, who are really supporting us to disseminate and create knowledge with our young interns. Thank you, thank you. I'm done.
Thank you, Professor Tumwine. I was just trying to turn my camera and my microphone back on. Thank you so much for joining us and for sharing your insights, your observations, your experiences with us. It's really just a fantastic presentation to begin and set the tone for this conference and the really important things that we need to think about in the production of knowledge. I'm just going to remind everybody, please do put any questions into the Q&A. We do have one so far, which I will ask you now. So one of our attendees has said that your point of view is so near to their own. Open access today is for the rich researchers of the world. This biased outlook, paying a lot to publish, is not open access. Do you have any suggestions on how costs can be met by publishers without killing opportunities for researchers in low and middle income countries?
Thank you very much. I love that, because our journal, African Health Sciences, is 200% open access. And I'm serious, we are 200% open access. But we are not even in DOAJ. We applied and we were refused membership. Those are the challenges we are getting. We do not charge anybody any money. We use the African tradition of volunteerism. So all of us who work on African health sciences, we are not paid. Sometimes we get an allowance. My volunteers get an allowance. I don't get an allowance. But we don't charge the authors, and we do not charge the readers. That's the revolution we are saying. Why do we need these words there? For me, I'm a researcher, and often I get exemptions from these very expensive journals, which are charging up to $2,000 per manuscript. We do research by observation, by people in the village, by people in our wards. In other words, a lot of the research we do is not funded. Fortunately, we get many exemptions, but sometimes we are rejected because we don't have the US dollar. That's the inequitable world we live in. So the challenge is health. Health should not go to the marketplace. That's my belief. Science, why should it go to the marketplace? Education, why should it go to the marketplace? That should be the responsibility of our representatives we choose, who control our economy, who can set aside money to support research and publication. Thank you.
Thank you for that answer. I think there's certainly a lot of members of OASPA who are publishing journals in the same way as you are. And lots of the attendees at this conference will be sharing the same experiences too, where they're running journals on a volunteer basis. Oh, I've just noticed, because you moved your camera to look at your slides, we can't see your face now. That's it. Thank you. Perfect. And I know that running journals with volunteers is very challenging. Do you think that the financial challenges are the biggest in your experience with your journal? And I'm also wondering about things like DOAJ, you know, how difficult that is for you to meet standards, or if there's problems sort of as a result of that as well, by not being able to meet those requirements.
No. Standards is not an issue. I started this journal in 2001, August. By April 2004, I was in PubMed Medline. By 2008, I was in Web of Science. So standards are not the issue. There is some hidden discrimination, because otherwise I can't understand. You put in an application and you are given a very flimsy reason why you are not accepted. In fact, at one point, we wanted to start our own database. Those who want to join us can join us. Because if people don't want us to join them, well, we retreat, but we continue. So it's not a question of standards. I can assure you we have very high standards. I think it's a question of insensitivity. People not knowing that if there's a challenge with my website one day because my power is off, that's not my making, but I can improve it. Yeah, if you have power in London, very soon you'll not have that power because of the gas prices. So that's what I'm saying, that for us, because we are living in this chronic credit crunch, we have to live in a different way, which is the survival way. But those who have only acute credit crunch, they may not appreciate that. For example, for us, recycling is our way of life. Then you travel to Newcastle in the UK, they say, oh, we have a project in recycling. What do you mean? For us, that's what we do. I don't throw away anything. So it's good. This is a smaller village. We learn from one another. And what we are saying is that it should take much more than money. It should take our willingness to share, to do research, to educate our people, to make observations. And we as publishers help even people in our village to write papers. Why not? They have a lot of knowledge which we don't have.
There's a related question which somebody has asked, which is asking, could you talk a little bit about how the scholarly publishing world could better help journals such as yours to thrive?
How can the scholarly...
Do you have any thoughts about that? Yeah, how could the scholarly publishing world help journals like yours to thrive? Is there things that we could do to support you and help you?
Yeah, so the question should be, is there a way we can cooperate? Because we need support on each side. It's not just people in the West helping us in the South. Let me give you a very good example. When I was a medical student in Uganda, people who were training in London at the Great Ormond Street, they found it very strange for mothers to be on the ward because the nurses said, they are a nuisance. How can you have mother on the ward? They interfere with nursing care. For us in Uganda, we said, no, the best nurse is the mother. And now the rest is history. Everybody in the world knows the best nurse is the mother. So we need to share our knowledge and experiences, and we help one another. If there is knowledge and experience that you, Claire, have got, it would be nice for you to share it with us. And if we have different experience, we also share it with you. Let me give you another example. In the Africa Journals Project, supported by the National Library of Medicine, 15 years ago, I presented at that meeting, and I said, I don't have money to print anything, so I'm going pure online. Everybody was saying, what? But now everybody is online. Really, printing is not a big issue anymore. So it's a question of equity and respect and knowing that we can help each other. We can learn from one another. And an organization like yours, yes, you can help us by helping in that training. Training is so critical. And training in research, training in publishing. Yes, thank you.
Thank you. And we're learning from you. I have another question here for you. Thank you so much for finally bringing this perspective to this important discussion. As an African myself, I feel so privileged today to hear you speak. How do we ensure that the economic value created by open knowledge, data in particular, is rooted into developing countries and not into making the rich richer?
That one, it was in my presentation, but I removed it because it's painful and it is sweet at the same time. We know the advantages of data sharing. There is absolutely no doubt. But there's also the pain of it. When I read a paper written by somebody, say, in Mexico, or in India, or in France, about using data that was collected by people in Uganda, but he or she does not even acknowledge that this data was collected by people in Uganda. And he or she has written a paper, has not even consulted the principal investigator. In other words, has just stolen the data. So what we need to do, in my view, is to get funding for both northern and southern researchers, and we work together to create a database, and we all benefit from it. And when we publish, those in the north and those in the west, or rather those in the south. But at the moment, there's a lot of stealing of our data.
Yeah, thank you so much. I think we do have a few more questions, but we are out of time now. So you and I thought 45 minutes was going to be too long, but I think we could carry on talking. So I wonder if we could follow up with these questions with you afterwards, and perhaps we can share in the Slack group your responses to those, and we'll not take up any more of your time now, and also let delegates have a little break before the next session. So I want to thank you so much for joining us today. And unfortunately, of course, Leslie was unable to be here, but I know that he was really excited to have you participate as well. And I know you and he have worked together for a long time. So thank you very much for joining us. And I can see lots of very appreciative comments from our attendees as well. So thank you for from all of the delegates here too. So we're going to have a break now, and then there'll be an extended opening discussion and a question session, which will follow in 15 minutes time. Attendees, you can stay connected, or you can come back at any time using the same Tuesday Zoom link. Thank you to this year's conference sponsors again, who are they'll be shown on a slide that's coming up. They've helped us make this event happen, but also for us to be able to welcome so many unfunded individuals to be able to participate as well. And don't forget to look out for the Mentimeter question code as well, and share your location. So everybody, please join me in thanking Professor Tumwine for joining us today.
Thank you. Thank you, Claire.